let me pick up where we were talking. Why is this exhausting?
Because when you think about it, we're dealing with existential threat. We're dealing with all of the difficulty that normally we have day to day. But then there's, oh, by the way, I could lose my job. I could run out of money. I could die. People close to me could die. That's a huge burden to carry. And just because we carry it day to day and week to week and now month to month, it doesn't diminish. It's a lot.
There is this extra element of, I think, a thing people are so afraid of normally, which is the idea of dying alone, around no one that cares for us, knows us, loves us. Not that medical professionals don't care, but, without your family. It is such a deep thing to contemplate. And I can't help but think that even people who are, not at much risk, they're able to social distance and stay at home, are chewing on that.
Yes, this is a traumatic experience. And as with all traumas that we have in life, we learn something we cannot unlearn. We have learned how terrible this can be. We have learned how isolating this can be. We have learned that people can be on the terribly uncomfortable machines for weeks and then die alone. We can't unknow that. And so the challenge to us is, how do we rise above it? How do we transcend the awfulness of it and make it through with as little bruising as possible?
What is your number one idea about what we should be doing to maintain our mental health?
I think the very first thing to do is to acknowledge the situation and to talk to yourself, to say to yourself, this is what's happening, this is why it's bad, this is why it is survivable. And secondly, to make a list of all the ways you can be kind to yourself, all of the things that you like to indulge yourself with, whether it's binge watching a certain show, having a certain food, being on the phone or on Skype with somebody you care about. Make a list of 10 or 15 things and have it out in front of you. So you have a menu. So when you get to feeling really down, really desperate, you can pick up the menu and just start doing those good things for yourself, one after another.
There are people who live in isolation, either they're single or seniors, who are saying at this point, this is just no way to live. And it's very hard to know what to say to them. I'm wondering what you should do if you feel that way, and also what you can do as a friend or loved one to support someone who feels that way.
It's important that we ask about suicide. When you ask somebody if they have thoughts of killing themselves or harming themselves, you're not planting the idea. You're making it safe to talk about. And if we suspect there's a possibility somebody may be in that dark a place, we should ask about it. And if indeed they are, we should immediately plan for safety. The next question is to ask, do you have a means? Have they stockpiled some pills? Do they have a gun nearby? And have them give that to you. What we know about suicide is it's a matter of about 10 minutes, that window of time when somebody first thinks they're going to maybe harm themselves and they take action. It's not days or hours or months, it's about 10 minutes. And so when we talk about that, if we can say, well, could you give me the pills? Could you give me the gun? And so we're immediately making things safer. But if things aren't that bad, but somebody is really depressed about this, really fretful about it, perhaps anxious about it, it helps to tell the story. It helps to talk about it. And so you might want to make sure that you check in every day or twice a day with that person, and that you give them room to talk about what they're thinking, what they're feeling, in a very non-judgmental way, to allow the thoughts. People will feel better simply telling the story, and we should respectfully hear the story.
I feel like we are going to have a part to play with one another, as well as, appointments via Skype, that sort of thing, in our public mental health going forward, that our involvement with each other around this topic is going to be different than it was before. Does that make sense?
It certainly does make sense. And again, we have to think about this as a trauma. It's a psychological trauma, and it's a life and death trauma. And so we are going to need to grieve and to heal as best we can from it. And to do that, we're going to have to be involved with each other. One of the things that I find is most helpful is when people in a situation like this sit down with a friend, a family member, somebody who they care enough about, and to talk about all of the strengths they've had in the past. What are all of the ways they have succeeded at something? And then strategize. How can they apply those strengths to this situation? And it's important to write that down and to have that list so that in the toughest of times, they can remind themselves of the strengths that they have. But it's important to do this with other people. And it's important to learn to tell the story of how they have been resilient over stress or trauma in the past. It's an inspiring story to others, and it's inspiring to ourselves as well. And so that interconnectedness of planning with others, of telling stories with each other, and encouraging each other is going to be very important in the months and years to come.
And there's kind of an inherent contradiction in that we have to deal with. We're all separated right now, and yet we need each other more than ever. And that unity is more important to our recovery and our sanity and our ability to cope than perhaps it's ever been.
That's absolutely right. And so that's one of the things that we have to acknowledge and say to ourselves. Say, this is a time when I need others more than ever. And also, this is a time where we have to be isolated. And we have to use those second best choices: phone, Skype, standing 6, 8 feet away from each other and talking like that. So we have to acknowledge the awfulness of the time and then figure out in a very deliberate way what second best solutions can we apply at this time. And we need to assure ourselves this will get better. There will come a time when we can be back together again. Now, having lived through the trauma of this, we now have wisdom we didn't have before, which is this could happen again. There could be another virus and we could go through all of this again. We have to learn to hold both of those things at the same time. There will be a better phase in this, and this is a trauma that can.
Some people feel very comfortable at home right now. They feel safe. You know, they don't have to deal with the public if they don't want to. And then when they go out to go to the store, some people are experiencing a lot of anxiety around that, what other people are doing, being extra vigilant, careful, worried. What would you offer to those folks?
Well, first, I want to acknowledge that the two things are happening. There's an increase in agoraphobia, a fear of the marketplace, a fear of going out in public. And there's an increasing claustrophobia, a dread of being alone and trapped. And so we get it at both ends. So again, I would first acknowledge it and then think about the smallest possible ways to mitigate that. Maybe there are some places we just don't go out to and we go out to others. Maybe we have our earphones on when we're walking to the store so that we have some music that we find pleasant, or we have a relaxation track that we're putting in our ears as we're out in public. This is a time where we have to be creative about all sorts of workarounds and things to augment us so that we can do those tough things. Margaret, you and I have talked before about that 4-7-8 breathing, where you focus on your breath, breathe into a count of 4, hold for a count of 7, and breathe out to a count of 8. That is something you can do as you're walking along or as you're driving to the store. Even in the store, it again focuses you on something meditative in your breath while you're gathering your groceries, for instance, or while you're passing people 6 feet away on the sidewalk.
Right. What strikes me as you talk about that is that, you know, I used to go to the store without thinking about anything. And now I kind of need a plan. I need a plan for leaving the house, for shopping, for getting back, for disposing of my mask, or, you know, washing it, whatever. And it's a lot. There's just a lot going on in the atmosphere of your own mind.
Yes, you have to really respect that in some ways, this is a life and death situation. This is a poverty or wealth situation. This is huge. And so you do have to do planful, deliberate things at a time when you feel least energetic to do so. That's something to just acknowledge about this time. It won't be forever. This is something that, maybe we're aiming at mid-July before we begin to ease up more and more and more. but it's not entire seasons, it's not entire years before things will be less burdensome than they are now.
My husband and I were just talking about the millions of people who have lost their jobs, who may be completely broke at this point. They may be soon without a home. They might not have health insurance. They don't know what's going to be next. It is the kind of stress that those of us not dealing with that can kind of easily miss in all of this. Um, the kind of pain and life change and crushing of dreams that can break people. What are we going to do as a country about that, addressing the stress and strain around that, not only for individuals, but for us as a community?
It is a devastating time, devastating. And there are people who are facing homelessness and poverty and perhaps losing ones they've loved. It is that big. And we as a community need to come together. We need to seize onto our better selves and be more generous, look out for ways that we can reach out to others. If we have some financial means, now is the time to give. If we know somebody who is going to be homeless, do we have an extra room in our house where they can be? This is a time for extreme generosity, and it will help us feel more powerful and better when we are giving to others and making a difference in their destiny.
If we feel like we need help, or if we feel like somebody we know needs help with their mental health, what's the best way to approach this in this climate?
First, keep in mind that even though you may not be a trained mental health specialist, you have within you the kindness and the respect and the caring that will make a difference for somebody else. And so extend yourself to listen, to acknowledge, to respect the reality they're going through. Encourage where you can, but your job is not to force them to cheer up. But just that respectful presence makes a difference. If you feel that their psychiatric health is more dire than you can deal with on your own, there is Crisis Solutions. We used to call it Crisis Line here in town. They're open 24/7. There are people there who can screen and refer people on to resources. We have over 45 mental health centers here in King County, spread all throughout the county. And those are places that can take Medicaid reimbursement for services. It can provide some services to people with no funding. There are also lots of psychotherapists in private practice. And so there's professional help available. There also is involuntary commitment. And if we find somebody is so desperate that they're at imminent risk of harming themselves, then you call the King County Involuntary Treatment Line and report that situation, and somebody can do an evaluation and get that person into secure help, a hospital.
If you lack health insurance, what's available?
Well, when we talk, Crisis Solutions is available, and many mental health centers have the capacity to serve some people who have no insurance at all. I would try both of those first.
How do you know when you need help?
You know, worry is normal, and worry is a sane reaction to these very challenging times. But anxiety is not. Sadness makes a lot of sense in these times of loss, but depression is not. We need to tell the difference. And if we are having alarming thoughts of harming ourselves or of suicide, that is not a normal state. And so we need to take stock and really answer that question for ourselves. Is this sadness or depression? Is this worry or anxiety? Am I feeling so overwhelmed I want to end it all? If any of those bad states come to mind, you need to immediately get involved with somebody else. You need to get on the phone with somebody, even a neighbor, even an acquaintance who you feel safe with. Share what's going on and problem solve with them about how and where you will seek help.
What should we know about little kids right now, and how this is going to affect them? They don't have access to school or their friends or their activities or their grandparents. Um, how do we help them get from here to there?
This is a traumatic time for adults, and it's a traumatic time for children. You know, I'm 70 years old, and I remember to this day the polio epidemic of the mid 1950s. I remember the summer that I couldn't go to the pool, that I had to stay away from garbage cans in the alley, that I was sequestered at home. I remember that from 5. And these children are going to remember things at 70 that happened this year. And so we're traumatized, they're traumatized. They're going to take a lot of their cues from us. If we gloss over this and say, everything's fine, no need to worry, don't be upset, go play, that's not honest. And they will know that's not honest. And they will take from that perhaps the message, well, I sure can't talk to mom and dad about this. That's not what we want to have happen. But also, if we get overly dramatic about it, and if we get overly anguished in front of them, that feeds them cues for how to deal with this as well. We want to be realistic. We want to be focusing on what we can do. We want to have involvement with our kids and with our adolescents to a degree. We want to be there for them. We also need to build in time for ourselves. And it may be that you take a 15-minute break in the bathroom with the door locked when you can, and have it be just your own time. So at the same time, you're having to go extra miles to engage the children and adolescents. You also need to go extra miles to take care of yourself. But the kids will follow our cue. And if we are concerned, but we have a plan, that's very different than if we're despondent and tearful and uh, desperate. That's not a helpful message to
Yeah.
send.
Teenagers often feel really, really constricted right now. You know, they may not, well, no teenager was built to be under the same roof with their parents 24/7, right? That's just not, doesn't really work for anybody over the long course. So what do we do as parents? How do we help our teenagers? How do we make sure we get along and that we try to figure out how to make this ship still sail?
The developmental task of the adolescent is to become increasingly self-sufficient and independent and leave home. That's their job at this point. And so we have a real challenge to that if pretty much 24/7 we're all together. One tip I would have for parents is give a lot of space. Give a lot of space to your adolescent. And they may prefer to be in their room or someplace away from you for much of the time. Give space for that. And also be very, very careful about choosing which power struggles you enter into. This is a time when perhaps you're going to be more lenient than you would be at other times. This is a time when give them space and aloneness and self-determination as much as possible, but be ready to be there on a moment's notice when that adolescent regresses to being sort of a child and is needy of you. Be flexible. This is not a time to hold out the highest standards at all times. Also, be lenient with yourself as well. Acknowledge that much as you love this child, much as you love this adolescent and care deeply about them, you also can't stand them at that particular moment. And you're fed up and you're feeling trapped and you're feeling inadequate inside and disliking them for making you feel inadequate. Acknowledge everything that's true. And then in a very mindful way, decide, I'm going to engage with this, but I'm not going to engage with that. I'm going to try and surmount this. I'm going to give up on that for this hour.
What should we be doing with our seniors? I'm thinking about people who are, maybe they're alone, maybe they're with a partner, but they can't see their grandkids, or they're in assisted living and they're feeling extremely vulnerable. And people know that older people are not doing very well with coronavirus and with COVID-19. What should we be aware of and how do we help?
You know, all of my older friends tell me repeatedly how much it means to them when somebody reaches out to them. If they get something in the mail from somebody, if they get an email, if they get a phone call, it's so deeply touching to them that somebody is thinking about them. I would you contact your neighbors who you talk to once a year and just out of the blue call, ask how they're doing, ask if they need anything. If they do need something, One technique is to shop for them, deliver it to the front door, knock or ring the doorbell, but have established ahead of time an agreement that they will wait a solid minute before they open the door to get what you've delivered to them. So there's no chance of you passing on anything else other
Yeah.
than gotten for them. But to reach out, to express caring, to remember with them things they've done that impress you. They need to feel valuable at a time when they feel lost and unvalued and perhaps extraneous. Think of ways to let them know how you value them and why.
There's a lot of talk these days that make, I think, a lot of seniors feel like they are being considered disposable. Oh, it just, this is going to happen to old people, and, so I don't care. I'm going to go do this other thing. I mean, there's a lot of that in the air. Uh, I don't even know what my question is, but what do we do about that?
It's important for all of us to feel that we're valued by some people for our entire life. And with the elderly, uh, with their lack of physical mobility, with perhaps lack of intellectual sharpness, it's easy to feel vulnerable and useless at a time like this. And so those of us who have that generosity, those of us who are capable of that kind of kindness, we need to step up and really show that with people. We cannot stop those who are sending the message that you really need to die so that I won't be inconvenienced. There are people who are sending that message, and we are not able to stop that. But we can present a different message. We have to make sure that we're careful not to give more than we can give. And there is more need out there than we alone
Hmm.
can each answer. But to give what we can give, to push ourselves, to be generous and kind, and to find ways to help the elderly know that they are legitimately cared about and legitimately valued, and that the world would not be better off without them.
And conversely, there must be room for us to acknowledge the economic pain that people feel, because they're often painted as a cartoon of people who don't care and just want to go to Applebee's or whatever. And that's not what's going on either.
We have to acknowledge for the people who are very impatient with this period of isolation and quarantine, we do have to acknowledge that there is a reason that they feel that way as well. We need to respect the frustration. We need to respect the fundamental fears and needs that they have. And we need to know that to get locked into a yelling back and forth does absolutely nothing but polarize people farther into their positions. So instead, while we understand, while we're compassionate, we need to still do the stuff that we can do to compensate for perhaps the damage or the hurt of what they do.
We've been hearing stories about people in assisted living or senior care facilities who are not allowed to leave their rooms, maybe even be locked in place. I understand that might be necessary for their safety, but I'm trying to imagine what that does to them as a person.
It must be terrifying, and it must be deeply lonely. It must be depressing. It must be anxiety producing. We have to respect that the situation is that awful, and those are reactions they may have. And again, they may come to feel suicidal. The population with the highest rate of suicide are men over 55, and that's in good times. So we need to know that there is a psychiatric danger at a time like this. Um, Again, if we can use all means that we have to make contact with them, to stand outside the window of their room if it's possible to do that. Again, to get on the phone if it's possible to do that. And to Skype or FaceTime if it's possible to do that. They need to be engaged and they need to be involved, because if they're not, and if they're left to their own thoughts and their own worries, that's the least healthy thing that can happen for them.
I totally understand. I was struck by what you said earlier, that, kids who are going through this, all of us that are going through this are going to remember this forever. It's going to influence us forever. It's going to be like my mom living through the Depression, because they were poor to begin with, and that was a disaster. And no scrap of anything was wasted ever, because she was pretty sure that was coming around the corner at her at any moment. So I'm wondering, is this going to be like 9/11, where life changes forever in some ways after it? And how do we sort of prepare ourselves for that, both individually and as a group, that it's not going to be like it was 6 months ago. It's going to be different.
This is much worse than 9/11. 9/11 was a bad event, but we permanently changed. We became an anti-terror nation. And now we have to go through screening machines to get into some buildings. And certainly getting on a flight is entirely different than it ever was before. The world is permanently changed by this, and this is fundamentally much worse than 9/11. This is global. It's all around the globe, and it's going on for a long time. We will be different. And so we have experienced a trauma. We are traumatized. It is a legitimate trauma. It's a life and death trauma. And we are going to have to process it and integrate it and weave it into our being consciously, or it will haunt us forever. We will never unknow the trauma that this can happen. We will never not know that. And it will stay with us until we die. If we can be resilient over it to some degree and say, this can happen, and we've learned to take these kinds of precautions, and we've learned to no longer shake hands. Isn't that odd? I don't think there will come a time again when we shake hands, when friends hug each other, coworkers hug each other. I think those times are gone permanently, because the possibility of deadly pandemic and viruses is greater now than ever, and will continue to be so. So we will have to learn new social norms, new ways of protecting ourselves in times of danger from this, and plan differently for safety and security. But this is probably the biggest event of any of our lives.
But we can still be okay.
If we do the work, we can be okay. And when I say the work, that is to very consciously think about resilience. Even in the toughest times, think about, what do I have to do today? What's the next step, the smallest possible step I need to do to keep functioning today? Maybe I need a 5-minute break. Maybe I just need to do the dishes. Maybe I need to make one phone call. And build on that, get some momentum. And that's where resilience comes from. At first, we think we're not going to be able to rise above this. But if we keep doing just that next thing, we build a momentum where we experience ourselves being powerful over the crisis, being a survivor of the trauma. And that one day we will find that we have overcome it. When we go through a trauma of any kind, we learn things as well as lose things. And we have wisdom that we wouldn't have had before. And that wisdom will come in handy in the future. It would be great if this had never happened. That's first choice. Second choice is, this has happened. We make ourselves be resilient. We learn to be a survivor, and there is strength in that that gives us confidence. We need to learn to tell ourselves the story of how we were resilient, so that in times of discouragement in the future, we can take out that story, remind ourselves of what we've overcome, and that will help us overcome other things in the future.
Thank you so much.
Thank you.
Is there anything else you'd like to add that I didn't include?
I think we've got it all, and I so appreciate your doing this, Margaret. You bring wisdom to the world that we wouldn't have otherwise. Thank you.
Bless you. Thank you very much.
Okay.
I'll talk to you again soon, I hope.
Bye-bye.
Bye.